Dr. Hooman Melamed, MD, board certified orthopedic spine surgeon, talking to you about artificial discs. We all have discs in our spine. This is a spine model with the artificial disc. So the disc is the cushion, the shock absorber inside. When the disc is not functioning properly, the disc is just not doing its job anymore, you could be considered a candidate for potentially artificial disc. Now, is everybody a candidate for artificial disc? Of course not. But if you are a candidate, it's a wonderful operation. You're not fusing the spine. It allows the spine to move basically. Typically, most of these are done as outpatient with very quick recovery. It's just like a hip or knee replacement. You know, if the patient is doing great and the alignment, everything looks great, normally that patient is gonna do great. You don't need to keep coming back. The fusion, you have to sometimes follow the patients for a year or maybe more to make sure the bone has fused together. And oh God, it didn't fuse, you have to go back and redo the operation again. On the patients that I felt they were fusion candidates before, now and more, I feel most patients are, if they need, they're a way better candidate for artificial disc than needing a fusion done.